Hello, everyone, and welcome to this talk. So today we will be talking about the assessment of lung function, and especially we will just concentrate a little bit on spirometry and peak flow meter because those are the most commonly used pulmonary function tests and something that we can all use in our regular practice as well. So I think this is one of the most apt topics for this season. I'm sure all of us who are dealing with patients are coming across a lot of cases of cough, cough remaining for a long time and things like that. So let's see how we can use the lung function to assess these kind of patients. So just to make this interactive as well, maybe the attendees can also just pitch in an answer. What are pulmonary function tests? Any thoughts?
So I request all the attendees, please write down your thoughts in the chat box or Q&A session. We'll have an interactive session today.
No answers on what is pulmonary function tests. Okay, maybe I think I started off asking questions too early. So maybe let me just start and then maybe we'll see if we can ask more questions later. So basically pulmonary function tests are, so they are a kind of non-invasive tests which are used for diagnosis, evaluation and monitoring of various respiratory conditions. And what do these do? What is the use of these pulmonary function tests? They help us, they give us an insight about the respiratory system, basically the lungs, especially talks about the large and small airways, pulmonary parenchyma, the pulmonary capillary bed, all of these things. They help us to measure different volumes and capacities like lung volume, lung capacity, rates of flow, oxygen, carbon dioxide, gas exchange, things like that. So basically, in a nutshell, if I have to tell you what is a PFT, it's a test that gives us an idea about how much air the lung can hold and how well the air is moving in, moving out of the lungs, and how how much oxygen is going into the bloodstream. So there are various indications for pulmonary function tests. Firstly, when somebody has a persistent cough, somebody is having wheezing, breathlessness, or maybe when you examine the patient, if you can hear some crepitations, or if you do an X-ray and you see that the X-ray is abnormal, then we can get a pulmonary function test done. Suppose if a patient has any diseases that can affect pulmonary function, like especially connective tissue disorders, like scleroderma and sarcoidosis or any neuromuscular diseases, because basically they start affecting the lung capacity and start, reducing the lung capacity. So we can do PFT in such patients. And we can do PFT in patients to monitor for disease progress and for treatment response, especially asthma. It's very commonly used. And also in other lung diseases like interstitial fibrosis, COPD, pulmonary vascular disease, and all of these things. Preoperative evaluation for patients who are posted for abdominal surgeries, lung resection surgery, cardiothoracic surgery, etc., to see how well the lung capacity is basically. And also for people who as a profession are exposed to toxins, radiation. So they suppose they work in a factory wherein they're exposed to asbestos or silicon, because they are prone for lung diseases like asbestosis, silicosis, etc. For such people, we can do it on a routine basis for a lung function evaluation. And also for a post-op surveillance following a lung transplantation, basically to assess for rejection, infection, and any obliterative bronchiolitis. So what are the different types of pulmonary function tests? Any ideas? Can we name a few?
So we had one answer from Aarti for the previous question you asked, doctor.
Okay.
PFTs are used to access the lung functions, including FEV1 and so many other non-invasive parameters.
Okay, yeah, that's right.
You're right. A few more answers from Nurul. Spirometry, peer flow meter,
correct,
respiratory rate.
Respiratory rate is mostly an examination finding rather than a pulmonary function test. Here we're talking about diagnostic tests. But yes, peak flow meter, spirometry are some of the commonly used pulmonary function tests. Gas diffusion study, yes, very good. So let's just go ahead and we will see. So spirometry, like you all said, so basically to measure various aspects of breathing and lung function, basically to see how quickly a person can move air in or out of the lungs. Lung volume is another thing. So this is basically also called as body plethysmography. So this helps in measuring the lung volumes, and it helps in indicating the amount of gas contained in the lungs at various stages of inflation. And diffusion study, this also somebody mentioned. So this helps in looking at the diffusion of gas, basically oxygen carbon hydroxide, across the alveolar membranes and assesses the integrity of the alveolar membrane. CPET, this also I think somebody mentioned. So this is useful to measure the effect of exercise on lung function test. So basically this is a similar to a TMT, but then it basically talks about the lung function rather than a cardiac function. Pulse oximetry, something that is being used very commonly, especially post-COVID. Everybody has a pulse oximeter at home. Something that we all have, we can do at home. Make the patient walk for 6 minutes and check for the pulse oximetry and look for the change in the oximeter readings. And arterial blood gas, which is ABG. So all of these things are different kinds of pulmonary function tests. I am not going to go into detail about lung volumes, gas diffusion study, CPET, and arterial blood gas because I don't think we have so much time. I will be talking in detail about spirometry and a peak flow meter because that is what is most commonly used and what will be most useful for us in our day-to-day family practice as well. Broncho challenge test is another thing. So just to give you all a recap of lung volumes, capacities, and different things, I'm sure all of us have read this in our physiology classes in first year MBBS. But then I would just like to give us all a recap so that we are aware of what we are talking about. So let's just hear of some volumes and capacities that you all can think of. Maybe we can come up with some answers. What are some of the volumes? What are some of the capacities? Lung capacities. Any answers?
So I request all, we have an answer from Noral, tidal volume.
Okay, very good.
Kashini, inspiratory capacity.
Okay.
And
Any other? There are so many volumes and capacities.
yes.
Residual volume, yes. Good. Okay. FEV1, yes. Okay. So I think we'll go ahead with this. So, like I said, there are various volumes and capacities. So this is a diagram that talks about the different capacities and volumes. So let me just talk about each of these. So first is the tidal volume. So basically tidal volume is the normal air that we inhale and exhale at a normal respiration. So when you're normally breathing, how much of air do you inhale and exhale? It's usually the normal value is around 500 ml. Then there's a residual volume. So basically residual volume is even after we expire out, all the air that we are able to, there is still some amount of air that is left in the lungs. So this is called as the residual volume, which is around 1.5 liters. And then there is something called as an inspiratory reserve volume and an expiratory reserve volume. So expiratory reserve volume is the air that is expelled from a lung during maximal forced expiration starting at the end of tidal expiration. So basically after the tidal expiration is done, between the tidal expiration till the residual volume, whatever air we bring out, that is the expiratory reserve volume. And beyond the tidal respiration, whatever air we inhale, that is during a maximum forced inspiration starting at the end of a normal tidal inspiration, that is the inspiratory reserve volume. So we have the IRV and the ERV. So if you look at the diagram, this is what it probably looks like. So And all of these things together is known as the total lung capacity. So I will be talking about that as well. So when we look at the capacities, so we have the vital capacity. Basically, vital capacity is tidal volume plus the IRV plus the ERV, which comes up to around 4.5 liters. We also have something called as the functional residual capacity, which is whatever is left behind in the lungs post the tidal volume, that is post normal expiration, which is expiratory reserve volume plus the residual volume. This comes up to around 3 liters. And then we also have the inspiratory capacity and the expiratory capacity. Basically, inspiratory capacity is the volume of air that is inhaled into the lung during a maximum forced inspiration effort that begins at the end of a normal tidal expiration, which is tidal volume plus IRV, comes up to 3 liters. And all of these put together is known as the total lung capacity. So tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume, which is around 5 to 6 liters. So that is the entire capacity of a lung. So these are some of the volumes and this thing. So when we look at, we also have a few more, which is the forced vital capacity. I think somebody mentioned that FVC. So basically, yeah. So the forced vital capacity is the amount of air that is exhaled forcefully and quickly after inhaling as much as you can. And this is what we use when we have to do a peak flowmetry. Basically, we ask the patient to take as much air as possible and then blow forcefully and quickly and exhale, blow into the peak flow meter, which gives us the forced vital capacity. And then this volume of air that is expired during the first second, second, and the third second, that is what we look at. That is known as a forced expiratory volume. So we have FVV1, FVV2, FVV3. So basically what happens is most of the air gets expired out during the first second. And then the next, the residual goes out during the second, and the third second. So that is how it happens. So forced expiratory flow, again, is an average rate of flow during the middle half of the FVC test. So if you can look at this, we have the FVF 25-75. So this gives us the average between the 25th percent and the 75th percent. What is the rate of flow? So that talks about the FVF. So another thing that is very important for us is the FVV1 by FVC ratio, which is the volume of air expired in the first second only, but then it's expressed as a percentage of the entire forced vital capacity. Peak expiratory flow rate is the fastest rate that you can force air out of your lungs. So this is an important slide for us. All of the other things, it might sound a little complicated, too many things to remember. But if we are able to remember these few things also, I think that will give us an idea when we are interpreting the spirometry results and the peak flowmetry as well.